Hello and welcome to our podcast series called Mind the Gap. And in this Mind the Gap series, we are trying to bridge the gap between healthcare technology, innovation, and governance. And so today's theme of the series is DPDP Act and remote patient monitoring, building a secure, compliant, and patient-centric digital healthcare ecosystem. So that is what we will be discussing today. As you all know that this hospitals and healthcare organizations are rapidly adopting different kind of technology in healthcare, like EMR, artificial intelligence, cloud platform, telemedicine, remote care monitoring and services, IoTs, wearables. So all these things actually generate a lot of patient data. And patient data become one of healthcare's most valuable asset as well as the greatest concern. So now, with this transformation comes a very critical questions that how can healthcare organization innovate while protecting patients' privacy and complying with the Digital Personal Data Protection Act. So to discuss this, we are joined by Mr. Sujeet Katiyar. He doesn't need any introduction, but still I want to say a few words about him, that he is a digital health strategist, a data privacy expert with over 27 years of experience in healthcare technology, cybersecurity, AI governance, and regulatory compliance. So with this very small introduction, which actually doesn't suit with you, still I'm keeping this because it's 20 pages introduction I have to tell then otherwise. So with that, I want to welcome you in this session, and we will learn a lot of things from you today regarding DPDP Act and RPM. In this session in coming 30 minutes or so.
Okay. Thank you, Surupa. Thanks for your nice words and thanks for having me here. Okay, so with nearly 750 million smartphone users, in 75 crores, half of the population is having smartphones, and one of the world's largest wearable device ecosystems. India now has the digital foundation required for healthcare beyond hospital walls. Remote patient monitoring is no longer a pilot initiative or at a very starting stage. It is emerging as a critical healthcare infrastructure for chronic disease management, aging population, and value-based care. So, what I believe that today's discussion is extremely timely because healthcare is undergoing a fundamental shift. Care is moving from hospitals to homes, from episodic interaction to the continuous monitoring, and increasingly from human-only decisions to AI-assisted care and AI-based care there. In this new environment, patient data becomes the foundation of care delivery. Their real question is not whether organizations can collect more data. The real question is whether they can use the data responsibly while maintaining the patient trust. And that is where the DPDP becomes relevant. And in my view, DPDP is not merely a privacy law, it is a trust framework for India's digital healthcare future.
Yeah, very truly said. So on that note, actually, my first question to you is, why should a hospital management or RPM platform owners consider DPDP a business priority rather than merely a legal, requirement? As you currently said, that this is not only a law, this is a trust factor. So then, right. On that note, what should the management see DPDP as?
Okay, so what I see and believe, one of the biggest misconception about DPDP is that organizations see it as a compliance project Okay, in reality, it is a trust and business sustainability project. Okay, for an RPM company, patient data is not a byproduct of care delivery. Okay, it is the foundation of the entire business model. Okay, every heart rate reading, glucose value, blood pressure trend, medication reminder, and clinical alert is based on the personal data. Okay, so if patient trust the platform, they will remain engaged. If they lose the trust, adoption will drop, then participation will drop, and eventually business value will drop. Okay, so not only here in India, even globally, we have seen this trend under GDPR. Organizations that invested in privacy gained competitive advantage because customers are becoming more conscious about how their data is being used, collected, used. Okay, so on and so forth. For RPM providers in India, DPDP should be viewed as an opportunity to build the trust, improve the governance, strengthen the partnerships with hospitals and insurers, and prepare for global expansion. My advice will be treat DPDP as a business enabler, not a compliance burden.
Yeah, that's a very good point. That it should work as an enabler, not a kind of a compliance. So this is very important to know all RPM providers that they should not kind of feel threatened about it.
Right.
It should be very, very embedded in their system. So that is a very good point. So my next question then would be, how does the RPM, kind of change the traditional view of giving consent? Is it because in RPM we are talking about 24/7 monitoring, etc., and then continuously data is coming into a typical platform. So then, how this traditional approach of data privacy for the patient, comes under the kind of consent management?
Okay. First, traditionally, healthcare data was generated inside a hospital, and that during a consultation, admission, diagnostic test, or any procedure. Okay, so and data collection was episodic. RPM completely changed that model. Today, a patient may wear a smart device 24 hours a day. Data may be collected continuously, transmitted to the cloud, analyzed using artificial intelligence, reviewed by clinicians, and shared with the care teams. This means healthcare organizations are no longer managing isolated clinical records. They are managing a continuous stream of patient health information. As a result, privacy can no longer be treated as a document signed during the registration, because that's what has been happening till now.
Yeah.
Now, patient need to be made understand why data is being collected, what data is being collected, who can access it, how long it will be retained, whether AI systems are involved in decision making, whether third-party vendors process this information, because these are the not only the mere questions, these are the rights which this DPDP has provided to the patients there. Okay, for RPM organizations, consent becomes an ongoing relationship rather than an one-time event. So RPM transforms privacy from an administrative activity into a constant patient engagement process.
Got it. So yeah, because it's always kind of sometimes it is 24/7 we are collecting data. Sometimes maybe some episodic data we are collecting. So people has this kind of always dilemma that what could be the correct process. So now this is very, very important to know that this is a 24/7 and a kind of a continuous engaging with the client who are using RPM or who are using some sort of wearables. So my next question to you would be that how the healthcare organization can build a trust on remote patient monitoring. As you previously told, that remote patient monitoring is not I mean, this is not only in hospital, it actually beyond hospital. So
Right.
now how patients and people who are the user of this kind of service, so how they will build trust, because everybody is very, very scared about where is my data, how
Right.
is the data protected or not or something. So how they
Right.
will build the trust on that.
A very good question. Let me start. Patients are increasingly willing to share data if they understand the value they receive in return. The problem is that many organizations explain the technology, okay, but fail to explain the data journey. Okay, let's take example of say a cardiac monitoring program. Instead of simply asking for consent, explain that continuous monitoring may help identify early warning signs and potentially avoid hospitalization. So you need to have the informed consent very well explained, okay, how it is going to help them, rather than just asking as a routine like, okay, you need to provide this consent there. So trust also comes from the consistency. Okay, if an organization says data will be only used for patient care, and then make sure that it should not be later appear in the marketing campaigns, analytics projects, or AI initiatives without appropriate transparency and without mentioning during the consent taking process there. Okay, so there should be a trust factor, which is very, very important. Trust is built when patients understand the value exchange between their data and their healthcare outcomes.
Yes. So now I can, these days people are very much interested, and it's in a kind of a trend that people are talking about AI into everything. So naturally, healthcare is also, affected by that AI thing. So then, I mean, how you will, everyone wants to deploy AI in some way or other, right? So are organization overlooking the privacy risk, the AI adoption in this AI adoption rush? So what do you think?
Right, absolutely correct. They are overlooking, and most healthcare organizations today are asking how quickly they can deploy AI. Okay, there are very few organizations who are asking whether they have the governance framework required to deploy AI responsibly. The biggest misconception is that AI is just another software tool. But in reality, it is not. AI systems learn from data, generate new outputs, may make recommendations, and sometimes influence clinical decisions. So, while adopting AI, organizations need to ask few questions. Where is the data going? Is patient information being used to train models? Can outputs be explained? That is like explainable AI. Can errors be traced? Who is accountable in case something bad happens? Okay. So these are few questions while adopting the artificial intelligence. Organizations need to ask from the vendor through the ethics committee or whatever mechanism they are having there. Here, one common example is employees pasting patient information into public AI tools, ChatGPT, Claude, and others, just to generate the summaries or reports. It may improve the productivity because these tools, they can help in a big way, but it can also create significant privacy and confidentiality risks there. Okay. So here, what my advice can be, before implementing AI, establish governance, policies, risk assessment, and clear rules for data uses. Okay. Organizations don't have an AI problem right now, whatever I can see. They have an AI governance problem.
Okay. So in that line, I have the next question, that what are the biggest privacy mistakes RPM providers making in their day-to-day operation, particularly when using, as you said, that when using tools such as WhatsApp, Gmail, or ChatGPT, or that kind of platform. So what are the biggest mistakes they are doing right now?
Yeah, there are many mistakes which not only RPM, the entire healthcare sector is making. Okay, so first let me be very clear. WhatsApp, Gmail, or any AI tools are not inherently non-compliant. Question is whether their use is governed, controlled, monitored, and aligned with the organizational policy. That is more important. Otherwise, you cannot blame the WhatsApp, Gmail, and ChatGPT or Claude, because they were never designed for healthcare setup. First of all, okay, and then it's not their problem. It's the organization who need to make sure that all the governance, everything is monitored properly. So problem is not WhatsApp. Problem is uncontrolled sharing. Problem is not Gmail. Problem is using personal accounts for clinical communication. Problem is not any AI tool, ChatGPT or anything. Problem is uploading patient information without understanding where that data is processed. Most privacy incidents do not originate from sophisticated cyber attacks. They are originated from everyday operational habits there. Okay. For example, a care coordinator may share a patient report on a WhatsApp group for convenience. The intention is good, but once the information leaves the controlled environment of RPM platform, governance becomes difficult because you lose the control of the data. And once you lose the control of the data, a breach has already happened. When it will be impacting you, that's secondary, but breach has happened. Similarly, employees may upload patient information into AI tools to generate summaries without understanding the implications. The issue is not the technology itself. The issue is uncontrolled usage. Again, organizations need to have the clear policies on approved communication channel, like whether WhatsApp can they use, if they can use, what kind of measures need to be taken, all the anonymization and de-identification, other things. AI uses, access control, most important thing, who can access the data, because that's again a gray area. What I can see, certain times non-clinicians, they do have the access of clinical data there. Data sharing, with whom data is getting shared. Retention. Okay, I think healthcare organizations never thought about data hygiene, deleting the data, okay, erasing the data which is not required there. Okay. And the training, the most important thing, until unless your workforce is not understanding why this DPDP is there, how it is going to benefit or how it is going to create the problems for us, it is, in my opinion, very difficult to enforce this thing, to be compliant with DPDP. So technology risk is often easier to solve than the human behavior risk. So most privacy breaches are process failure, not a technology failure there. Yes,
true. Do you think data minimization in RPM would solve any problem?
Of course. Data minimization means collecting only information which is relevant, necessary to achieve a specific healthcare purpose. Here, if we compare it with the previous typical health setup, the challenge is with RPM is that technology is making it easy to collect everything. Okay, just because a device can capture hundreds of data points, it doesn't mean that every data point should be collected, stored, and retained indefinitely. Okay. For example, if an RPM program is focused on hypertension management, blood pressure reading, maybe essential in that case. If it's hypertension management, then but continuous collection of unrelated information may not be required there. Okay, so more data doesn't always mean better care. In many cases, it increases the privacy risk, security risk, storage cost, and the regulatory exposure as well. So, question should not be what can we collect. It should be what do we genuinely need to improve the patient outcome. That's what I see from the data minimization point of view.
Yes, of course. In that line, I have another question. I mean, almost same kind of question, that how important is the vendor management? Because, in RPM, many hospitals or insurers or a healthcare organization are engaged with not only single vendor, so it's a multiple vendor management sometimes. So how DPDP actually help organization to manage this kind of data processors, I would say.
Data processor, okay. So vendor management is absolutely critical. A modern RPM ecosystem, it involves device manufacturers, cloud service provider, AI vendors, messaging providers, analytical platforms, including the call centers, and as you mentioned, the hospitals and others. Patient data travels through this entire ecosystem. Okay. And here the problem is with the assumption. Many organizations assume that once data is handed to a vendor, the responsibility shifts to the vendor. That is not how modern privacy regulations work. Okay. So, not only here under DPDP, even under the GDPR or HIPAA, accountability remains with the organization that determines the purpose and means of the processing. Okay, so if I go back to the certain definitions there, so as you said, the data processor. Okay, so apart from data processor, we are having the data fiduciary there. Okay, and data principal. Data principal is the patient we can treat. Data fiduciary, it's somebody who determines the purpose and means of the processing. Purpose means why data is getting collected, and means mean how data will be processed. So there is nothing like data processor. All the IT companies, okay, they are going to be the data processor under our condition. No, if by any chance, if they are having anything, any say in the collection or processing, means like any say RPM or HIS or telemedicine platform. Okay, so they are working on the instruction of the hospital, and whatever data they have collected, if tomorrow they are analyzing the data, they are using that data for AI training, then this is a different purpose. Okay, so because the purpose you get the consent is related to that treatment. Okay, the care. If you are using for the secondary purpose, this was the primary getting the treatment. For the secondary purpose, it need to be mentioned, and there should be like separate consent which is required. So organization should understand what data from the vendor point of view. Okay, what data vendor receives, why they receive, how they are protecting it, whether they use subcontractor, because nowadays, like, okay, there is a chain, some vendor, they are using the some AI, there, some APIs, some other things there. Okay, and what happens during a breach? Okay, what is the responsibility of data processor there? Everything should be documented properly and should be in the form of any contract there. Okay, so that is very, very important because compliance posture is only as strong as the weakest vendor in your ecosystem.
And maybe the vendors are actually the fiduciaries also.
It all depends. It all depends. I always say that you should go by the definition. Like while collecting the data, if you are working purely on the instruction of the hospital, okay, or any care service provider, or nothing beyond that, then you are a data processor. Okay, by any chance, if you are having any say, like you are collecting more data, take example of insurance companies. Okay, for fraud detection, they are taking a lot of data there. Okay, but that is not requirement of the hospital because I, as a patient visiting hospital to get the treatment there. Okay, yes. So for the treatment, what all information is required is a primary requirement there. If you are going for the secondary can be the AI, even medical college and hospitals for teaching purpose. That's a secondary use. Okay, this DPDP is not stopping from the primary use. There is no role, I'll say. Okay, the main role is with the secondary use of the data. If you are going for the secondary use, then you should be very, very careful there. Be it AI training, many times we say, okay, for AI training, we will de-identify the data, we'll anonymize the data. Okay, but even in that case also, you should inform that your data will be used for AI training and will make sure that everything is de-identified, anonymized. Okay, nothing will be like your identity won't be revealed there. Okay, so this should also be mentioned there in the at initial stage within the consent thing with the document along with the consent notice.
Okay. So everything, has to be very, very transparent while
right. Exactly. Whatever you are going to do, whatever your vendor or your data processor is going to, you must mention. It should be recorded because that is going to be the evidence. Okay. Anything it is absent, then in that case it is problem. Okay, then whatever your data principal or your employee or your vendor is saying, the maximum responsibility under DPDP are on the data fiduciary.
Right. So basically, RPM companies need not to be, worried about, secondary analysis or anything because DPDP is not stopping them. They have to be very, very transparent. Saying
okay, first
you should inform exactly they want to do.
Right. First, you should inform your this hospitals or any kind of this care setup is there. Okay. So there you should be very, very transparent. Like what all you are offering, where you will be storing, for how long you will be storing, and then after the same thing will be conveyed to the patient because this DPDP revolves around the patient. Okay, and everything is with the consent there.
Sure. So what technical control basically every hospital or RPM platform implement to support DPDP compliance? What kind of technical controls they need?
As far as the technology controls are concerned, there is no single technology that can create the compliance. Okay, compliance is achieved through multiple layers of the protection. Okay, so I'll maybe at minimum organization should implement at least strong and multi-factor authentication process. Previously, I mentioned the role-based access control. That's very important. Okay, because I have been part of quite a few HIS telemedicine platform, remote patient monitoring platform in designing. So we have given the entire control to the admin. Okay, so admin can create new user, receptionist, and then you can uncheck the options there. Okay, make sure in case of the PII and mainly the patient data. Okay, only clinician should have the access there. Then next comes the encryption of data in transit, at rest, while and you should be having the secure backup, audit, logging and monitoring. Everything like suppose you are taking consent online. Okay, you have provided some kiosk or some device there. What if patient says no consent was taken? No consent was taken. maybe patient can lie with whatever reasons. Then you should have the proof, like from which device, what time. Okay, so these kind of all the logs should be maintained there. Data retention and deletion control should be in place. As we discussed, vendor security review should be there. Okay, but in my opinion, technology alone is not enough. Many organizations, they are investing in cybersecurity tools, but at the same time, they are neglecting the governance, training, operational control. So my recommendation is to focus on building a defensible security and governance program rather than purchasing more and more tools there.
Tools, yes. Yeah. So last question, that as digital healthcare continues to evolve, so what is your suggestion or message you want to give to the CXOs or RPM founders in implementing DPDP?
Very simple. Do not view DPDP as a compliance deadline. View is an opportunity to build the trust infrastructure for the future of healthcare. Digital health, AI, remote monitoring, predictive analytics, and personalized medicines all depend on the patient data. What I see over next 5 years, every successful RPM company will look like a technology company, a healthcare company, and a data governance company also at the same time. If I can say one message, that will be build trust first, compliance second, and technology third. When trust exists, everything else become very easy.
Good. So let's have a very quick rapid fire kind of questions regarding DPDP to make it more interesting. So should we start?
Sure.
Kind of, yeah. One-liner question. Just what is coming into your mind having the question. So DPDP in one word.
Accountability.
What is the first step toward DPDP compliance for a hospital?
Know exactly what patient data you collect, where it goes, and why.
One DPDP principle every RPM platform should never ignore.
Purpose limitation.
Can accountability for patient data ever be outsourced?
No. Processing can be outsourced. Accountability cannot. Accountability always stays with the data fiduciary.
The biggest DPDP mistake healthcare organization make?
Treating compliance as one-time checkbox rather than a living program.
Privacy by design or privacy after deployment?
Of course, privacy by design. Retrofitting privacy is expensive as well as ineffective. And in healthcare, it can be very dangerous.
Yes. Which is more dangerous, poor cybersecurity or poor consent management?
Both are dangerous, but poor consent management can make even lawful processing unlawful.
One document every hospital should prepare immediately to implement DPDP.
One can be data flow map. They should understand where this thing, and if I can add, that can be the privacy notice, because it is the public face of your entire data governance. Means at the time of consent collection, the privacy notice that hospital should prepare immediately.
What is the most valuable asset under DPDP?
Patient trust.
Complete this sentence. The future of digital healthcare belongs to?
Future of digital healthcare belongs to those who earn patient trust by design, not by compulsion.
Very nice. That is all for today, and this is really very interactive and informative session by yours, and we are really enriched with all the information you have given us.
My pleasure.
Thank you very much, Sujeet, to join this.